What's up everyone? My name's Dr. Mitch Rice, back with another Medical Monday, and today we're going to be answering the question, what exactly is hypertension? Before we dive in, as always, there'll be timestamps here at the beginning of the video, so feel free to jump around to whatever interests you the most. So let's get to it. Before we can talk about hypertension or elevated blood pressure, we have to have some sort of an idea of what blood pressure is. Blood pressure is the force of blood pushing against the inside walls of arteries. Arteries are pipes that carry oxygen-rich blood throughout your body. Your blood pressure is measured using two different numbers. The top number is also called your systolic blood pressure. This is the blood pressure measured when your heart is beating. The bottom number is also called your diastolic blood pressure. This number represents your blood pressure in between heartbeats. If you'd like to know even more information about what blood pressure is, I'll put a link to my blood pressure video in the top corner. So now that we have some sort of an idea of what blood pressure is, what exactly is hypertension? Well, understanding what blood pressure is, it's fairly easy to understand what is happening when you have elevated blood pressure or hypertension. During hypertension, the blood is pushing with too much force within your arteries. This usually occurs because the structural integrity of our arteries have become narrowed for some reason. Now, there's several reasons why this could happen. One is elevated cholesterol. This can lead to the formation of plaques that can narrow your arteries. Two is diabetes. The mechanism by which diabetes occur can actually damage your arteries. Three is increased age. As we grow older, our arteries begin to narrow. Four is smoking. The carcinogens seen in cigarettes and other forms of tobacco can damage arteries. Number five is obesity. Having a higher BMI can also narrow your arteries. And number six is family history. So because of any one of these reasons that your arteries begin to narrow, your heart has to work even harder to push the appropriate amount of blood throughout your body. If this occurs for a long enough period, life-threatening things can happen. Some of these things include kidney disease, heart disease, strokes, and even heart attacks. So what are the normal ranges you may find or see for blood pressure? So your blood pressure is considered to be in the normal range if your systolic number is anything between 90 and 120, and your diastolic number is anything between 60 to 80. Again, systolic means the top number, and diastolic means the bottom number. Systolic is when your heart is beating. Diastolic is in between heartbeats. Your blood pressure is considered elevated if it has a systolic range of 120 to 129, or a diastolic range of 80 to 89. Hypertension stage 1 is any systolic value 130 to 139 and any diastolic value 80 to 89. Your blood pressure is considered hypertension stage 2 if that systolic number is anything above 140 or that diastolic number is anything above 90. So just summarizing a little bit of what's on the screen here. If your blood pressure is above the normal range, it's called hypertension. And conversely, if your blood pressure falls below the normal range, it's called hypotension. So, knowing all of this information, how can you best reduce your chances of getting hypertension? Or if you have hypertension, what steps can you take in order to reduce your overall blood pressure? Number one is a healthy diet. Now, everyone knows eating healthy is beneficial for you. However, it can be very challenging to do. If you want to know more information about how to eat healthier if you have high blood pressure, I'll put a link to one of my videos in the top corner. To summarize, it's recommended to eat more fruits and vegetables regularly. This means at least a couple of servings of fruits and vegetables throughout your day, either with breakfast, lunch, or dinner. Also, limit your salt intake to fewer than 2,000 milligrams or 2 grams a day. And last, avoid excessive alcohol consumption. Limit your intake to no more than about 1 alcoholic beverage a day. Second is exercise. Try to get at least 30 minutes of cardiovascular exercise a day. It can be as simple as walking around your neighborhood for about 30 minutes. But diet and exercise are the 2 most important things that you can do in order to reduce your overall blood pressure numbers. Number 3 that's super important to do is to stop smoking. I know it's an extremely difficult thing to do, but quitting smoking can pay dividends for your future. Again, if you would like more information about specific diets or specific exercise plans, please visit my website at www.wellsci.me for more information. Thank you all so much for checking out this video. Stay tuned for next week as I'll be discussing which medications are typically used to treat high blood pressure and a little bit of information about each of them. Again, thank you, and I will see you all on the next one.